Hello, viewers. Welcome back to the another episode of Pediatric Respiratory Health podcast series. I am Dr. Arunima here, Associate Professor, Department of Child Health Nursing, Bharati Vidyapith deemed to be University, College of Nursing, Navi Mumbai. Today we have Dr. Suhas Karch, pediatric consultant. Sir have vast 10 plus years of experience in the pediatric clinical field. We are happy to welcome you, sir,
Thank
for
you
the
for
another
having me.
episode of respiratory allergies in children.
You.
So we can we start, sir?
Yes, sure.
So my first question is, what we understand from the term respiratory allergies in children.
The term respiratory allergy means it is the exaggerated response of the immune system to the less hormone component of the air around us. When these allergens are inhaled in the lung, there is a massive release of the histamine and which causes different manifestation of the respiratory allergy. So what is respiratory allergy is nothing but the overactivity of the immune system towards the certain inhaled allergens in the surrounding air.
So what are the causes and what triggers this kind of allergies in children?
So most common triggers for the respiratory allergy are from the household only. The common dust mites are the most common trigger. Now, where these common dust mites are found commonly, they are found in the mattresses, pillow cover, curtains, in the stuffed toys like soft toys, or even in the thick carpet.
Mhm.
So, if you and the second most common uh, trigger are pollen grains.
Hmm.
Now, the pollen grains can be either tree pollens or grass pollen or wheat pollen.
Mhm.
Then third common trigger
Hmm.
is either fungal spore or mold.
Hmm.
These fungal spores and mold are specially found in the damp areas of the house, such as kitchen, bathroom,
Hmm.
or soakage in the wall. Then another triggers are like any kind of smoke in the house, like mosquito coil burning
Hmm.
or dhoop batti
Hmm.
or tobacco smoking.
Hmm.
So these smokes are also
Hmm.
acts as a allergic trigger.
Hmm.
Then certain common viral infections
Hmm.
which are seasonal in nature, they also cause a
Hmm.
trigger for the allergy. So these are the most common triggers
Hmm.
found to precipitate the allergies in
Yes.
children.
So you actually already mentioned about smoke. Along with that, any kind of air pollution factors, pollutants which can.
Yes, air pollution, especially from the industrial area and emission from the vehicles, they add on to the manifestation of the respiratory
Mhm.
allergy. They worsen the symptoms of the allergy and they hold on the particles
Mhm.
which worsen the symptoms of the allergy.
Mhm.
So air quality around us
Mhm.
and the air pollution play major important role in the manifestation of the allergy.
Mhm. Season changes, climate changes, or any kind of other environmental factors which can that.
Yes, basically, many the content and quality of the air around us and the antigenic exposure
Hmm.
is different in the different season.
Okay.
For example, like in the spring and monsoon,
Hmm.
the tree and grass pollens are more common,
Hmm.
whereas in autumn and winter,
Hmm.
the weed pollen and the molds are very
Hmm.
common. In monsoon, the fungal spores are
Hmm.
very common. Then temperature,
Hmm.
if there is a sudden change in the season and cold temperature, so moving from warm air to the cold air also precipitate the allergy because that cool air irritates the
Hmm.
airway.
Hmm.
Then in this even dryness of the air, sudden dryness in the air also irritates the airway. So yes, because there are different allergens in the different season,
Hmm.
the seasonal changes do play important role in the allergy.
So how, what kind of signs and symptoms, how the child manifest with the allergies
Yeah.
from initial to the like complicated phase.
Yeah. The most common manifestation of allergy in the children is allergic rhinitis. So, what are the features of the allergic rhinitis? This is the common cold, runny nose, itching of the nose
Hmm.
and eyes, watery eyes, frequent sneezing,
Hmm.
and then which it can progress to allergic asthma, which then frequent night coughs, breathlessness, tightness in the chest. So these are the most common symptoms of the respiratory allergy.
So my next question is same a branching question. How we can differentiate these respiratory allergies with common cough and cold?
Yeah, very good, because it is very important to differentiate common cold from the allergic rhinitis. So, first and most important thing is common cold is caused by the viral infection, whereas the allergic rhinitis is because of exposure of allergen to the nasal mucosa. The common cold usually is associated with a fever because it is because of the viral infection, whereas allergy is not associated with a fever. Second common differentiating factor is the common cold, the secretions are thick, greenish, and yellowish, whereas in allergies, secretions are clear and watery. And common cold starts relatively late, that is 1 to 2 days after onset of infection, whereas allergy starts within minutes or hours after the exposure to the allergen. And common cold generally do not cause severe itching in the eyes and nose, whereas allergic rhinitis causes severe itching in the eyes and nose. And sneezing is not very frequent in common cold, but sneezing is very frequent. In fact, there is a paroxysmal sneezing in allergic rhinitis. So these are common differentiating point between allergic rhinitis and the common cold.
Okay, sir. Thank you. And any age specification, like at the age of 4, or when the child usually develop this kind of allergies?
So most common age for developing allergy, respiratory allergy in pediatric age group is between 3 to 12 years of the age. Amongst 3 to 12 years also, 3 to 5 years of the age is the most common presentation of the allergy. Less than 1 year of age, generally we don't saw many respiratory allergy because the allergen exposure during that period is very less. So 3 to 12 years is the most common age group because child is more prone for exposure to allergen during this age group. They go out for playing in the garden, so they get contact with the plants,
Exposure,
so exposure to pollens. They go in the ground to play, so dust exposure, mite exposure. So the common age of exposure is 3 to 12 years because the exposure to allergen more in that age group.
Right. Sir, how you manage your patients when they come with allergy?
Yeah. So management of allergy patient is first the medication. The commonly used medications for allergy are antihistaminics, for example, cetirizine. The second common use medication for allergic rhinitis is inhaled corticosteroid nasal spray. Then sometimes you have to use mast cell stabilizers like Montelukast. If there is allergic asthma, you may have to use inhalers. So this is for treatment, but prevention is also important.
My next question was that actually, sir. So
Yeah.
can you brief on that?
Yes. So the prevention is considered as a part of management. So what I told earlier was the medical management of the allergy, but how to prevent it? So prevention of allergy is nothing but the prevention of exposure to the allergen. So how we can do that? So how we can avoid exposure to dust mite? So in the household, we can use dust resistant or mite resistant mattresses, pillow cover, curtains. We can avoid using stuffed toys or soft toys if we have a kid with allergy at home. We can improve the air quality by keeping the room well ventilated. We can use air purifiers for improving the air quality of the room. Then we should avoid doing any smoke in the house, like no dhoop batti, no mosquito coil, no smoking in the house if we have a kid in the home. Then second thing to prevent, one should keep windows closed during a high pollen period. So generally we say high pollen period is either early in the morning or late in the evening. So during this period windows should be closed. Child should not go to a high dust exposure area, like where there is a lot of dust, so that can be prevented. Child can take a vaccination which is available against common viral infection. So common viral infection cease to act as a uh, viral
Sir,
allergy
vaccines
trigger.
like which? Can you just list down the
So
vaccines?
common viral infection against which the vaccines are available are influenza,
Hmm.
which is the most common.
Hmm.
Second, in some countries, there is a vaccination available also against respiratory syncytial
Hmm.
virus. Okay, but it is in India, there is no
Hmm.
vaccination available against RSV.
Hmm. Okay.
Okay, so I think everyone should take flu vaccine
Hmm.
in the before the start of rainy
Hmm.
season,
Hmm.
especially kids who have an allergic issue.
Okay. So my final question is like, what are the home remedies or any diet modifications, lifestyle modification, and help out in controlling it?
Yes, the home remedies which are helpful in the preventing allergic respiratory problems in children is a steam
Oh,
inhalation, which is very easy to do at
do at
home.
home.
What steam inhalation does, it loosens the
Hmm.
mucus, is keep the oral yeah, the respiratory tract moist
Hmm.
and prevent the exposure of allergen. Second thing what we can do is certain dietary modification. For example, avoid using packeted food
Hmm.
and food which has a preservative. Okay, generally they do not cause respiratory allergy, but we have seen some preservatives in the food also
Hmm.
causing respiratory allergies. Like we have seen some children who eat chocolate, they have allergy
Hmm.
of chocolate preservative and they suddenly develop cough
Hmm.
cold. So avoid taking food which has a preservatives. Second thing what we can do at home, we can use certain food
Hmm.
which has antioxidant property.
Hmm.
For example, green leafy vegetables and fruits, especially fruits which contains vitamin C
Hmm.
like amla, orange, they have antioxidant properties and they help to reduce the respiratory allergy. You can use a turmeric milk
Hmm.
which has an anti-inflammatory property. One can use warm soups, warm water,
Hmm.
so which has a soothing effect in the airway and also keep the airway moist,
Hmm.
which also help to reduce the allergy. Then we can use frequent saline nasal drop,
Hmm.
or we can rinse the nose with a saline nasal spray.
Hmm.
So what happens, they wash out the allergens
Hmm.
which are there in the respiratory passage
Hmm.
and avoid the allergy. Then we can also modify the
Hmm.
lifestyles, like we can do regular exercise.
Hmm.
What regular exercise does, regular exercise increase the lung capacity.
Hmm.
So even if we have allergic exposure,
Hmm.
the manifestation of the allergies are less,
Hmm.
the breathlessness is less
Hmm.
because the lung capacity is
Hmm.
better. Then lifestyle modification like using mask while going to overcrowded
Hmm.
places, avoiding the dust or mite
Hmm.
exposure. So those lifestyle modification will definitely help.
Thank you so much, sir, for enriching us and given time for this healthy conversation. Okay. Thank you,
Thank
viewers.
you.
We'll be seeing with another video on the next episode. Thank you.